Protect yourself. Here are 15 steps you can take to reduce your risk of a hospital-acquired infection. Most of us will have to go into hospital someday, so here are some specific steps you can follow to protect yourself from deadly hospital infections. Number 1. Ask that hospital staff clean their hands before treating you, and ask visitors to clean their hands too. This is the single most important way to protect yourself in the hospital. If you're worried about being too aggressive, just remember your life could be at stake. All caregivers should clean their hands before treating you. Alcohol-based hand cleaners are more effective at removing most bacteria than soap and water. And don't hesitate to ask, "Excuse me, but there's an alcohol dispenser right there. Would you mind using it before you touch me so I can see it?" Don't be falsely assured by gloves. If caregivers have pulled on gloves without cleaning their hands first, the gloves are already contaminated before they touch you. Soap and water is better at preventing C. diff. Patients should wash their hands before meals or be assisted to do so if they are bedridden. Number 2. Before your doctor uses the stethoscope, ask that the diaphragm, that's the flat surface, be wiped with alcohol. Stethoscopes are often contaminated with Staphylococcus aureus and other dangerous bacteria because caregivers seldom take time to clean them in between patient use. Number 3. If you need a central line catheter, ask your doctor about the benefits of one that is antibiotic impregnated or silver chlorhexidine coated to reduce infections. Number 4. If you need surgery, choose a surgeon with a low infection rate. Surgeons know their rate of infection for various procedures, so don't be afraid to ask for it. Number 5. Beginning 3 or 5 days before surgery, some people like to shower or bathe daily with chlorhexidine soap. Various brands can be bought without a prescription. It will remove any dangerous bacteria you may be carrying on your skin. Number 6. Ask your surgeon to have you tested for MRSA colonization at least 1 week before you come into the hospital. Your GP will do this for you as well. If you have it, extra precautions can be taken to protect you from infection. Number 7. Stop smoking well in advance of your surgery. Patients who smoke are 3 times as likely to develop a surgical site infection as non-smokers and have significantly slower recoveries and longer hospital stays. And then to number 8. Before your operation, discuss with your doctor the issue of antibiotic use. For many types of surgery, a pre-surgical antibiotic is the standard of care, but is often overlooked by busy hospital staff. However, the excessive use of antibiotics is implicated in the causes of HCAIs and C. diff in particular. Number 9. Ask your doctor about keeping you warm during surgery. Operating rooms are often kept cold, but for many types of surgery, patients who are kept warm resist infection better. This can be done with special blankets, hats and booties, and warmed IV liquids. To number 10. Do not shave the surgical site. Razors create small nicks in the skin through which bacteria can enter. If hair must be removed before surgery, ask that clippers be used instead of a razor. There is research to support this strategy. Number 11. Avoid touching your hands to your mouth and do not set food or utensils on furniture or bed sheets. Make sure your table is clean. Germs such as C. diff can live for many days on surfaces and can cause infections if they get into your mouth. Number 12. Ask your doctor about monitoring your glucose or sugar levels continuously during and after surgery, especially if you're having cardiac surgery. The stress of surgery often makes glucose levels spike erratically. When blood glucose levels are tightly controlled, heart patients resist infection better. So continue monitoring even when you are discharged from hospital because you are not fully healed yet. Number 13. Avoid a urinary tract catheter if possible. It is a common cause of infection. The tube allows urine to flow from your bladder out of your body. Sometimes catheters are used when busy hospital staff don't have time to walk patients to the bathroom. If you have a catheter, ask your caregiver to remove it as soon as possible. Number 14. If you must have an IV, make sure that it's inserted and removed under clean conditions and changed every 3 to 4 days. Your skin should be cleaned at the site of insertion, and the person treating you should be wearing clean gloves. Make sure you alert hospital staff immediately if any redness appears. To number 15. If you are planning to have your baby by caesarean section, follow the steps listed above as if you were having any other type of surgery. Ideally, you should choose a hospital with a low infection rate, and going private is not always a protection. Good luck getting that information. It's difficult. MRSA bloodstream infection is notifiable since 2004, but wound, bone and lung infections from MRSA are not reported. C. diff is notifiable since May the 4th, 2008, but the figures for individual hospitals are hard to come by. There needs to be a clear record for each hospital of the HCAIs incurred in that hospital, and this should be available to the patient or prospective patient. It's unfair and dangerous to prevent the public from knowing which hospitals have infection epidemics. Keeping infection rates secret may help hospitals save face, but it won't save lives. Don't be afraid to ask questions about healthcare facilities as well. Keep your wits about you in outpatients clinics, daycare centres, nursing home and doctor surgeries.